Ayer Board of Health will convene an open session. Is there any public input? Seeing no one here, is there any public on Zoom?
No.
And there is none. Okay. So the first item that I had was to ratify the working agreement with the Neshoba Board of Health, which I already signed because it had to be back the 31st of July. So I dropped it. Bridget had asked me to do this, so I did.
Good. Perfect.
So anyhow, if we can have a motion to ratify the annual agreement with the Neshoba Board of Health. I guess that goes to the Massachusetts Department of Health.
Yeah, I think it does. Yeah, I will make a motion that what is this thing technically called? That we ratify the shared services agreement between the town of Ayer and Neshoba associated with health.
I second.
Motion is made and seconded. Any disagreement? All those in favor?
Aye.
Aye.
Um,
I assume it's what we have to have, right?
Yes.
Is it copy or do you
Yes.
have, okay, yeah.
Yeah, I already gave
Do
it
you
one
want
to
to see it
show.
or-
So.
Every year. I have the copy.
Okay.
So the solid waste hauler regulations.
Yes. So, unlike these soil waste. Yeah, Bridget and I talked last week briefly. She and I need to review them together, and I have, kind of gotten myself organized with some stuff from other communities, but we just haven't gotten a chance to sit down and do it yet. And I think Bridget will enlighten us later that she's got a little more on her plate. All of Neshoba has a little more on her plate with all the new COVID cases.
Yeah.
So
Do we want to try to do this for October or something? Because Lori is still on Sobel, isn't she still part of that, or?
Is she stepped down from one of the,
yeah, but I thought she said this was like going to be the last project that she
Yeah.
continues with. So yeah, you think, Bridget, if we do set a goal for that of at least getting our review done and getting some formal recommendations to the board by one of the October meetings?
Yeah, that should be fine unless things get worse.
Well, yeah, that's true. Yeah.
But yeah, I have them, and I have gone through them, but like you, Kim, I just want to go back through other towns.
Yeah.
I don't really think there's a whole lot that really needs to be changed, maybe just a few things. But it's something that we can definitely, again, tackle together.
Yeah.
But I do have them, and it's something that I think it's more looking at other towns too.
Yeah. Okay.
So we'll try, if we did that for October, then you'd have to have a public hearing after that too, right?
If we
Change
change it significantly.
Yeah.
you can do a small, like there were only two lines that we were looking at in there that needed some amending, I
I
thought.
think what it might come down to is what Lori Sabol was requesting. It is that we target something, it seems to me, more to residents and landlords in town to make it so that they have to offer recycling. And I think if we did that, I think the gist of or the direction rather of the regulation would have to change, because right now it's the solid waste haulers regulation, and the only people that it regulates really are haulers. It doesn't have anything to do with landlords or residents or anything like that. So I think for this regulation, I think you're right. There were like maybe just one or two really minor things. But then it raises that larger question of, do we want to go out there and do something that targets landlords and residents and so forth? So.
And the other part of that was the oversight on that.
Right.
was a big piece.
Yeah, was how would we enforce it? What would be the?
Heather made it clear that she wasn't.
Yeah, all right.
Remember that?
When you were driving around checking the tracks for Shirley, and you won't do it for us.
No, when I lived in Shirley.
I know they had referred that Harvard or some other town, one of their.
Oh, yeah, that's right,
One of their
Yeah.
admin assistants was taking that on.
Yeah, I was in Shirley. Yeah.
Yeah.
You don't have enough on your plate, I guess.
Someone wants to take over, all building,
Yeah.
plumbing, gas, mechanical, sheet metal, whatever, electrical permits, and then all the requirement items for planning board, gladly.
I think Brady is dying to dig into some of those trash
I'll
rolls to
keep
see what's in
those
there.
dumpsters.
Yeah.
So if we can do it for October, I think that'd be good.
Yeah.
Just-
Okay, all right.
Okay. COVID-19. Bridget.
Oh,
Let's go.
welcome back, COVID.
Yeah.
So it's not, I wish I had better news. I talked to Tamara right before I left this afternoon, and the numbers obviously are increasing, I would say substantially, and with the cases, a lot of contacts go with those cases, which just makes things a little bit more difficult for contact tracing. But overall, it's just, the CDC did update or its guidance, and now said that if you are vaccinated, if you can't be 6 feet inside, wear a mask. Again, it's just, every day it seems to be getting a little bit worse, unfortunately. So, and a lot of it, Tamara said, has to do with travel and larger gatherings of people. We are seeing some people get COVID a second time. But she just said a majority of the cases are non-vaccinated people. There are some breakthrough cases, but again, a majority are the non-vaccinated people. And a majority of the cases are people between 20 and 60 years old.
Did Tamara say anything about, I know in the past when they did the contact tracing, we had it was an easier, well, not easy for you guys, but to track it. But with the breakthrough cases, that's a whole different box to check. Like are they doing contact tracing and then doing the 2-week quarantine with the same folks?
So there's quarantine guidelines. If you are positive, you have to follow the, and honestly, I have to go back and review those, but it's, I think you can go back to work after the,
10 days?
8 days or 9 days or something like that. But again, I have to go back through and have a refresher on that. But a lot of it, again, is the symptoms, the breakthrough cases of people are, most of them feel like they have allergies, and that's the problem. Is a lot of, we don't know. I mean, are the people that have not gotten tests done and actually have had breakthrough cases that we don't know. So it's really, it is transmittable through people that are vaccinated can spread the virus. So it's just, like I said, it's hard because some people, I know several people that they didn't even know they had it. They got tested because they were close contact and they were positive. And they did say that it was mostly just a sinus thing that, with the weather and everything, they just attributed it to that.
The summer
Yeah.
cold.
Yeah.
Hearing about.
Yep.
Makes you think.
So the CDC guidelines did change. We've been trying to let people know that. So, including, businesses and schools. But again, it's just a recommendation until something changes.
Yeah. So there aren't any mandates out.
Businesses are starting to set mandates, town halls are starting to set mandates. I think as time goes on and as it gets closer to the opening of school, we'll probably see more, businesses have mandates.
Yeah. Okay. But there's nothing at the state level at this point, right? It's
Just
all
for the healthcare workers, public
Yeah.
transportation, just that whole group. So that's it.
Okey dokey.
Are you seeing many cases in the area, Bridget, reported cases?
Tamara said it depends on the day. Just a couple of weeks ago, it was maybe, I think she said about, cases would trickle in here and there. As of last week, we were getting anywhere between 30 and 40 cases a day.
Really?
Oh,
Yeah, so I think they were up to 36 maybe, like last Friday. Today, I think they were up to 21 when I talked to them, and they are pushing stuff to the CTC right now because, again, there's so many, people are doing so many things and there's so many contacts. And they're also dealing with the fact that people are hanging up on them. They don't want to give them any information. So there are people that are sick and they're just
yeah.
not giving any information about who they were around, so they can't notify the appropriate people.
Are they gonna start the testings like in the assisted livings, nursing homes, that kind of thing? That'll be at another level.
I think they have been doing that. It just depends on the facility, but, obviously, when I've been going to do the food inspections at some of these places, obviously, you can't get in without a mask. Some of them are, I think, starting to limit the number of people back into the facility. Again, it's just sort of case by case and facility by facility right now, but it's hard.
Yeah. What about
And I think-
hospitalizations lower this time around?
The what?
What about hospitalizations? Are they're less severe cases? Are we seeing that in the numbers?
They're definitely less severe, less severe with the vaccinated, definitely. That's why some people don't even really know that they have it. They just think it's allergies. A lot of people describe it as sinus pressure, minor headache, but they're not, again, we're not seeing as many hospitalizations, we're not seeing as many deaths.
Yeah.
But we are seeing obviously a lot of cases starting to come back in.
Yeah.
And, sorry.
Saying hello.
But, again, the hard and the saddest part is the people that are vaccinated now at the 6-month mark are the people in the assisted living facility. So as of right now, there's no, booster shot for them yet. But they're the ones that, they're vulnerable again because their vaccine, a lot of them is past 6 months.
What if I know personally, what if you've had COVID, supposedly made the antibodies, and had your vaccine? Is it still a 6-month time frame for them?
I think it's different for each person. Some people, they have antibodies, 8 months after having COVID and having a vaccine, and then, after 8 months, I think that's, 8 months is a long time. But, again, we're well over a year and a half into this, so there's so much that we're still learning. But I think the hardest part too is this variant is different than previously.
Yeah, do you know that? Are we seeing, I think Massachusetts is seeing lots of Delta too, right? We're kind of the same as the rest of the country, it's mostly Delta?
Yeah, I think so. Again, there's so many numbers. I think it was something like 90% of the cases now are like Delta.
Yeah.
That was one number that I think I had read.
Yeah.
So, the hard part about that is, again, is the longer that it's there, the better chance it has to mutate again. Is the next one going to be
Right,
worse?
yeah. Is the next one gonna find its way around the vaccine?
Right. I mean, again, I'm by no means the expert, but I'm just going by what Tamara says for, specific to this area, that there's definitely breakthrough cases for sure, but most of the cases are people that are not vaccinated. Most of the people that are really sick, again, are non-vaccinated, and there's always gonna be that case where, it's somebody young and they are vaccinated and sick for whatever reason. But looking at the big picture, it's just, it's spreading like wildfire, and the community spread is great, and it's spreading through families again, so.
Is there any news on the 12 and under, the vaccinations for those kids?
From what I heard, they're hoping this fall. But again, it seems to change constantly.
Yeah.
The recommendation that I saw was that if you have someone who is at high risk, and even if you're vaccinated, you should have a mask around them or not be around someone that's at high risk.
Yeah.
But even you can have no symptoms at all and still have a viral load. So the danger is then you have someone who's vulnerable, and you don't know if you have a viral load, then you can pass the virus back on to them.
Yeah.
So, having a mask on, you're seeing someone at high risk, probably not a bad idea. I think Bridget's absolutely right. We're learning stuff every day on this.
True.
But
It's changing.
it mimics what happened in the past.
Yeah.
Very similar. Bridget, thank you so much for what you do.
Thank you.
Yeah.
Thank you.
Any update from Neshoba?
So, did you happen to bring that, Emily up?
Yeah, I brought the stuff you gave me last week.
Yeah, so I think, there was just a Dunkin' Donuts inspection there, and then, I'm trying to think, we've had some, like, housing stuff come up, but nothing major. I had been doing re-inspections for housings that were done before, the ones on Washington Street, so, other than that, it's really just been COVID, unfortunately.
Title V is septic permit.
Yeah.
Yeah.
Who is-
We don't get any of
This
those.
is for 84B Groton School Road.
Oh.
And
So that one, by the way, that's a failure, is that correct?
I know it says passed. It's a certification. It says passed certification.
Is it 24, you said?
84.
84B.
Oh, okay. Okay. I thought we had one that came in that, was a failure, they're gonna be tying into town sewer. Oh, the 84, that was the housing, right?
No,
Right,
there's
eight-
a, yes.
84 is the housing inspection that you did.
Okay.
And
I can't hear that well, so
84B
so-
was the septic Title V.
We both are 84B.
okay. So yeah, 84, there was a housing
The
done.
numbers
It was
are weird, but yeah. There's a housing.
That way-
84 too.
was not a legal apartment, and that is going through the building department right now. He did issue a cease and desist.
That's 84, but this.
Yeah, it's, the numbers out there are really off just because of how it was built.
There was a basement apartment
Oh,
that
yeah.
didn't need any.
Yeah, so it's not, it's off, it's 84 off of Groton School Road, it's not Groton School.
Okay.
But it does.
And
Yeah, I
we
did that on all
have
sides.
That's okay.
a pool permit for Neshoba Valley Townhouse condominiums. Is that right? 24A Harvard Road. Public, semi-public swimming and wading pool. Neshoba Valley Townhouse condominiums.
Oh, that's-
Townhouses.
The townhouse is on, heading a little by Madigan's,
Oh, okay.
so they're gonna have a
Oh,
It's
okay, I
waiting.
see.
They've always had.
They've always had something
Yeah.
over there?
Yeah.
Oh, so they're just getting re-inspected then?
Yeah, so, every year, they've had a permit for a long time, and, so Kaylee, every year, she will do she'll work with them when they get licensed, she'll send out the application, she does the pool inspection, and then after everything is all set and they are in compliance, she issues the permit.
We good with those?
Yeah,
Okay.
so one of them go this way.
Yeah, I got it.
And then you did a food service inspection today, is that right? For a new
I
restaurant?
did, is it the last stop?
Oh,
I forget the name.
Next stop?
The next stop, yeah. So they had their pre-op inspection today and, so they're getting ready to open. So we'll be issuing their permit and, I think they're scheduled to open in about 2 weeks.
Anything else? Bridget? That's it?
Yep.
Okay,
There you go.
so next item is the minutes from the 12th. You were good.
Yeah, and I looked at these and they're good. I'm not sure if minorly is technically a word, but it works in the sentence. No, this is better than to have them minorly block the sidewalk. And I thought, that's a word or not, but if it isn't, it should be.
Sounds good to me.
Yeah.
Minorly, yeah,
No, it works
Yeah,
for me. Yeah.
It didn't yell at me that it wasn't a word.
Good, maybe it really is. It's
I mean, I'll
good
double check
teachers
it.
that I've never come across.
I was asked my sister, she's the English teacher. Yeah,
Well, if it isn't a word, it should be.
she
one,
does
so.
English.
I didn't
math
see
and
anything, but
science, so.
I didn't
That's why.
either. So
So motion
I
to,
will move then that we accept and approve the minutes of the July 12th, 2021 meeting.
and I'll second it because you weren't here.
Right.
Motion's made and seconded, any discussion? Hearing none. All those in favor?
Aye. Should I sign this
Sure.
one? Oh, this still has me as chair.
Oh, I'll fix that.
So you want me to sign this one?
Yeah,
or
you just
no?
want to just cross it out and I'll just fix it,
Okay.
I'll just fix
Alright.
it going forward.
See, mine printed in a strange way, so I couldn't tell it's
Yeah,
weird.
Oh, I see,
I
yeah.
finally fixed the
Okay, all right.
phone number on
Let's do
top.
this.
I did that.
What's today's date?
Nine.
My daughter's 40th birthday.
Is she?
Wow.
It's my ex-father-in-law's 83rd birthday? Yeah, he's 83.
I made my correction, I'll let you make yours.
Thank you.
Yeah, Doug's 83 today.
Wow.
I don't know a lot about
No.
I
It's
know
gonna be
a
the
few.
17th, it's Melissa's birthday, which is their cousin.
Yeah, we got a few Augusts.
There's like 17 August birthdays at a time.
Is it?
It's family extended.
We have any mail?
Um,
Bills?
No bills. No, anything from the mail? Anything substantial from the mail? I don't believe so.
I have a question from a resident that I didn't think really rose to the level of public input. I don't even know if we are the right people to ask. But strangely enough, we have Bridget and you. And between everyone, you might know the answer. Yeah. And the question was, this person had watched a documentary about calling ambulances. And if you get an ambulance that's outside of your insurance network, you know, you can be billed with some outrageous out-of-network rate. And so they asked me, if I call 911 in Ayer, who do I get?
Air.
Is it,
Ayer.
it's always the Ayer.
As long as they tell you who they want.
Unless they're,
Do we subcontract anything?
no,
Any ambulance work?
no, but they have a mutual aid network, so that
Okay,
if the air ambulance isn't available, they'll call someone in the mutual aid network.
okay.
And quite, you know, it depends if it's on that end of town, it might be Littleton, this end might be
Yeah,
Devon's.
makes sense, yeah.
But yeah, it's just town of Air.
And then does that get billed to insurance? So is that like on every
Insurance,
insurance network out
Medicare.
there?
That I don't know, but I would assume
Okay.
that, you know,
Yeah, I would think for municipal ambulances, that
but your question's a good one, because I've seen some outrageous bills for air transport helicopters
Oh,
that aren't covered
84.
for crazy amounts of money, you
For
know.
my mom's helicopter ride.
Oh my
Oh
god.
my goodness.
Get good insurance.
I used to be
Good
an
for
ass
her.
by insurance companies when I had, whatever, I issued it, was one of my pregnancies, and I had to go from Emerson to Brigham and Women's, and they asked why I was transferred.
Oh, come on.
And I actually lost the baby, so it was a whole thing.
Oh,
So I'm like,
jeez.
I was at 32 weeks, and they don't offer that. And they go, oh, okay. And then my ex-husband ran himself over the tractor. And Hayfield and the insurance company called and they go, is he on someone's property? And I said, no, town road, because otherwise they would have gone after the landowner.
Oh, wow.
So there's, yeah.
Very specific.
They're very specific.
Yeah. So I guess what it comes down to is, do you have anything to add to that, Bridget? Do you know
Insurance is
anything about
weird.
ambulances and insurance and?
It was on John Oliver
Like-
2 weeks ago. That's
I think
Oh, okay, that must be.
yeah, John Oliver last week, but it was 2 weeks ago.
It sounded familiar to me too, and I always watch it, so I'm
But
on.
do
I
you,
used to
not
watch
that
it on
I've called
Tuesday nights.
911 in a long time, but I know back the one time that I did and you called from your cell,
It goes to the
not-
state
it
police.
goes to the state police. If it was a
Oh.
landline, that was why my mom still kept her landline.
And that's all
Because
changed
it-
since then, because
So it
most
still
people don't
goes
have
to the state
landlines.
police?
I haven't tried it, but it did go to the state police last that I knew, and they ask you, you know, what location you're at, and they may transfer the call.
Then
then.
they transfer, okay, that's how it works still.
Interesting.
Yeah, because a lot of people that got rid of their landlines that, for that.
Yeah, that's true,
Yeah.
yeah.
No, I have one.
Do you happen to know, Bridget, about like the air ambulance service that you get through the fire department? Is that like kind of on everybody's insurance network? So,
I think every insurance is different, so
Yeah.
it really depends on the plan and, that's my understanding. What I might be covered for might cost me more depending on my insurance, what type of plan I have.
right. Okay.
So yeah.
But you don't get it for free because you pay taxes, right?
No.
It's not
Oh,
free.
no, it's not like that.
I would think so. Yeah, exactly.
No, it's not.
It's not like that.
I assumed not, but I thought I'd ask anyway. Okay, I think I've done my due diligence on that one. This is not where I have issues.
Do we have anything else to come before the board? Is there a motion to adjourn?
Oh, I will make an emotion. I will make a motion to adjourn. Yes, I move that we adjourn.
I second.
Motion made in second, in discussion, hearing none. All those in favor?
Aye.
Thank you.